And Health Cabinet Secretary Aden Duale has defended the government's plans to establish an Ebola quarantine facility at Laikipia Air Base, saying the center is part of Kenya's broader disease preparedness strategy. Speaking before the National Assembly, Duale said the proposed quarantine and isolation facility is among 23 similar units established across the country to strengthen the country's response to infectious disease outbreaks. According to the CS, the facility will be jointly managed by the government of Kenya and the Kenya Defence Forces under the command of the Air Force Commander, the base commander and the medical personnel from KDF, working alongside officials from the Ministry of Health. Appearing before Parliament, Health Cabinet Secretary Aden Duale defended the government's Ebola preparedness measures, saying isolation and treatment facilities established across the country are intended to protect all people within Kenya's borders, regardless of their nationality.
They are not exclusive facilities. They are not facilities reserved for any nationality. They are public health assets established and coordinated under the authority of the government of Kenya.
Duale noted that Kenya has hundreds of security personnel on peacekeeping mission in the Democratic Republic of Congo, in addition to several other Kenyans living and working in Ebola-affected regions, particularly Uganda and the Democratic Republic of Congo, who could potentially be exposed to the disease and require quarantine or treatment upon returning home.
In the event of a suspected case, the response will be guided by medical triage, exposure risk, clinical need, and public health protocols.
The CS said the government has designated national and county health facilities, temporary holding centers at points of entry and out-of-hospital isolation units as part of the country's emergency response framework.
Our objective as government is to protect communities, to protect healthcare workers and the country.
Whereas no Ebola case has been reported in Kenya, surveillance, screening, laboratory testing and emergency response systems have been heightened to prevent any potential outbreak. Meanwhile, 60 of Africa's most senior health officials met virtually on Wednesday in a meeting chaired by Kenya's Principal Secretary for Public Health and Professional Standards, Mary Muthoni. Discussions focused on the challenges slowing containment efforts, including inadequate contact tracing, porous borders, weak surveillance systems, and limited access to medical resources needed to respond quickly to outbreaks.
Understanding to strengthen the border and having strategic stockpiles of the supplies, it needs resources. International communities have already actually committed to an extent. WHO also has released actually its own funds. We have now other resources from other donors, including the Gates Foundation, including the World Bank.
However, amid the concern was a shared determination to act.